As the pandemic surged on and the number of cases in the Philippines skyrocket, it serves as evidence of how unprepared and lackluster our government response is to the global dilemma. But what seems to be an isolated problem is actually part of a much larger issue that has been plaguing our country even before the pandemic began.
Welcome to SILAKBO, where we listen to each story as they unfold the truth about the Philippines.
I am Clark Fredrich J. Barcelona with my partner Dustin Reyes. Join us today as we tackle the issues and question the mishaps that have made our country suffer for so long.
Ever since the early 2000s, the Philippines have always been a top exporter of nurses around the globe. But what is concerning is the fact that the country itself is experiencing a shortage of medical workers, including nurses. And the reason as to why most Filipino nurses would rather work abroad is simple: neglect from their own government.
This is Marie, a 30-year-old nursing graduate and a public health worker, a single mother of two, and the breadwinner of her family. Despite having low salary, especially during this pandemic, she still takes the risk of going to work every single day just to save people's lives. So Marie, how much do you earn per day or every month? Is it enough to support your family's everyday needs?
Mga 13K na kukuha kong sweldo at hindi talaga siya sapat para sa mga gastusin ng bahay at sa pagpapalaki ng mga anak ko.
With the current situation of the Filipino health workers not being compensated enough, do you have any plans of going to the US or another country for better opportunities?
Naisipan ko na dati na baka siguro mag-OFW na lang. Marami kasi akong narinig sa mga iba kong katrabaho na malaki raw ang kita. Saka marami mga nurse sa Pinas ang mga nag-OFW na lang.
Do you have a message for the government as they continue to neglect and ignore the voices of the healthcare workers?
Sa tingin ko talaga dapat makinig naman sana sa amin yung gobyerno sa mga hiling namin. Hindi naman namin gusto ng sobra-sobra. Sana lang ay makuha namin yung mga benepisyo na dapat makuha namin. Tingin ko naman dapat lang yun.
This is Julie, a 15-year-old daughter of an overseas Filipino worker. She is one of the many citizens of the Philippines whose condition could not be treated well by local hospitals. So instead, they resort into flying overseas to find the treatment that they need. Why were you sent to a foreign hospital instead of one here in the Philippines?
To be honest, hindi talaga kami ganun ka-confident pagdating sa treatment tsaka medication facilities here. Because my mother told me that one time nung bata pa ako, na-hospital ako. But then, an accident happened, and dahil doon, mas lalong lumala yung condition ko. Sa pagkakaalala ko, dahil ata yan sa malfunctioning machine, so that's why mas pinili na namin pumunta ng America for my treatment.
How would you describe your experience in a Filipino hospital compared to an American center?
Sa totoo lang, kumpara sa mga facilities na nakikita ko dito sa Pilipinas, the hospitals in America are much more advanced. Marami silang treatments and facilities na hindi talaga nakikita sa bansa natin.
And lastly, Julie, what do you think that the government can do to improve on their healthcare systems and catch up into international standards?
I honestly think that we should focus more on resources sa pagdevelop ng health institute and facilities. It's not a bad investment kasi tayo rin naman yung makikinabang sa huli.
This is Juliana, a full-time researcher based in the Philippines. She lives in a country where speaking up for the minority or the unspoken truth is looked down on. She has been criticized for most of her governmental-focused research, yet still continues to voice out the things that matter. So, Julian, how can you delineate the efficiency of the current and previous administrations in terms of handling emergency responses?
If you would remember, during the first year of the pandemic when the COVID-19 plague has already hit most countries, the government our government did not impose a travel ban right away, and only until a Chinese national was confirmed of testing positive was the travel ban imposed.
Well, what do you think will happen if the government employs urgent and appropriate safety measures to prevent COVID-19 rapid transmission?
If the government was quicker in implementing the travel ban response and actually prioritized safety, there is a chance that we may have never had any cases, or at least have lowered number of cases compared to what we have right now, and perhaps a lockdown might have never been needed.
What do you think should be the solution to the unjust and poor healthcare system COVID-19 has exposed?
We need a leader. We need a leader who is knowledgeable when it comes to health-related protocols and is willing to do what is right in dire situations.
As the pandemic pushes us to rely more and more on our medical institutes, it's clear that the effect of our government's blind eye towards our healthcare sector in the past until the present has continued to ravage the lives of middle-class workers and common citizens alike.
Because of lack of prioritization and initiative, the modern world has left the Philippines behind in terms of medical innovation and quality of standards. Yet despite that, we have remained to be one of the globe's most reliable exporter of nurses and medical workers. As the ignorance and disregard continue to this day, one question remains.
If they will save us,
save us,
who will save them?
who will save them?